Good afternoon, everybody. Today is January 4th, 2020. My name is Scott McGann, doing our weekly COVID update. We're doing it on Monday. This is for the last Friday. The data is set up for last Friday to kind of keep consistency between week to week. So we're doing one today on January 4th. We'll also do one again to catch back up on this Friday. That way we'll be back on our Friday schedule. So our COVID-19 update will be all from, this is basically Friday's presentation. So Falmouth Health Department is our department. The health@falmouthma.gov is our email. falmouthmass.us is our website, and our phone number is 495-7485. So as of Friday morning, we had 715 cases of COVID-19 confirmed since March 19th. 101 probables since 12/1. Convenient MD began doing some antigen testing around then, and so I thought that worth putting it in there. They're not quite additive. Some people that get antigen tests may also get a PCR, so they would be double counted if you looked at just the straight numbers here. But a lot of people that are getting these probables aren't becoming considered confirmed, so that brings that number down from the 715. It brings that number artificially lower than what it probably is if the probables were confirmed PCR tests. So there's been about 51 confirmed. This is confirmed cases during the 7-day period from Christmas to New Year. About 75% of the cases are no longer in isolation. It usually takes 2 weeks or so, at least 10 days, up to 2-3 weeks to be out of isolation. With a lot of cases that we've had recently, that number is a lot lower than what you're used to seeing. We're about 12.6% of all cases in Barnstable County. Expect to be about 14. We're down, so it shows that 13.8 was what we were on the 24th. So it shows that we've had a little bit of slowdown, and part of that slowdown would be from the probable. Some of it's just that we've got a few less cases, but the rest of the county is doing a little bit worse. So of course the contact tracing continues with the VNA, the CTC, the health department. We just keep banging these out and going through them one by one, and so that's where we are for January 1st. If you look at our chart, you can see that since about the beginning of December, we've had quite a bit of cases. We've been averaging between 50 and 80 cases. Earlier, a couple of weeks ago, we had a lot of long-term care. Most of these cases are not long-term care. We are still getting a few here and there, but this represents mostly community spread between individuals. Most of the outbreaks are associated between family gatherings that have happened, among households, among friends. That's the primary place that people seem to be getting it from, would be from, I didn't think I could get it from my friend. I've seen my friend 12 times since the pandemic started, and 13th gotcha. So it is from mainly the small gatherings. It's not as much from going out to grocery store or things of that nature. It's really the close contact, the intimate contact from gatherings, getting together and nature. So we had a better week than last, though with the probables, we're probably a little bit somewhere in between, but we did have some probables back when we were 80. So I would say on whole, we're a bit better than we were the week before. You can see our curve, which was very flat all summer long and into the early fall, has really taken off, and obviously we've had a lot of cases over just like the rest of the state has had several weeks. So again, the state categorizes every Thursday. They'll come out with the state dashboard, town by town, and it'll show gray, green, yellow, and red. Red being the highest risk, which would be for us greater than 43 cases and 5% positivity. If you're less than 5% positivity and greater than 43 cases, you're in yellow. We remain yellow now for our 5th straight week, which shows us we had a few less tests. Obviously, with Christmas, there wasn't as many tests, so our test was down by 600 during the holiday week. That's to be expected. Our positivity climbed to 4.2%. Our incidence rate was slightly less. Was that at the point that this data was taken, we had 685 confirmed cases. That was taken. That would be ending on the 31st. The 26th. Sorry. So this full weeks would be from between the 13th and the 26th. We had 127 cases, which for the 2 weeks previous was 129. So we're pretty flat with our percentage positivity going up a bit, mainly because we had less tests. Barnstable County is bit worse off than us. They're at 34 daily cases per 100,000 and a positivity of 5.49. The state is we're probably doing twice as good as the state, at least as far as the incident rate. But our percent positivity is still about 2.5% lower, the 2%, a little bit greater than 2% better than the states. So, we've been able to remain yellow, but if the positivity at 4.2 becomes 5 or greater, then we would be triggered into the red. There's been a lot of towns on the Cape that have triggered red recently, and for example, Barnstable has been red for quite some time. So, quite a bit of cases out there. It's not really much different from the week before. Maybe slightly less cases. Over the weekend, we're back. I think we had about, we would say about 15 or so over the weekend. So now we're probably in that sort of around 730 cases, and that'll be reflected in Friday's presentation. So I just had to try to cut it off at the same point every week to keep consistency. Our testing and our percent positivity. So our percent positivity, the lighter the color, the better on the right. You can see that our percent positivity is a bit lower than our friends, our neighbors. And our testing regime has been as strong as born for, obviously that's adjusted for population. So we're doing okay. We're doing okay with our testing, and I think our testing will go up. It'll be low probably this week because you had New Year's, but then it'll creep back up, probably starting this week. Barnstable County has got about 5,708 confirmed cases as of the 3rd, the last update I got from them. And you can see that the 3-day, averages, we've been averaging quite a few cases here and there. This is the day, this is the 3-day average one. And so you can see that, we continue on the upswing and, need to knock it down. And, the social distancing and the mask wearing and not going to places that you don't need to go and not overextending yourself and going to many places is going to go a long way to help. Doing. The daily dashboard. The daily dashboard comes out every day. This happened to be yesterday's. There was 3,000 cases and 44,000 tests with an 8.42. That's a terrible number for a 7-day average positivity. The turnaround time for testing is over 3 days. If we have, some days we do, on the weekends we're going to have less tests, but when you get up to the 70 or 80,000, we usually have between 5,000 and 6,000 cases. We have 2,291 in the hospital. 416 people in the ICU in the state, with the average age of death at 81 and the hospitalization at 73, with 105 confirmed deaths on this given day. So those numbers aren't good. They're exceeding what we had earlier on in the spring. All of our metrics, our 7-day average of confirmed cases is way up, and is up over last week as well. Our positive molecular test rate is up. Hospitalizations are up. So obviously there's up results as well. So things aren't looking good, and we're in sort of that real dark days. So again, testing, confirmed cases is up. Positivity is way up. It's 9.28 if you take out the factor of the higher education. So if you take out the routine higher education tests, our positivity is pushing 10%. That's quite high for the state. We're not nearly as that. We're again 4.2, so we're less than half of that. Hospitalizations are up 684 from early December, the 11th, up 1,500 plus 1,684 from mid-November. ICU remains unchanged from the previous week, but is up 109 from early December. So everything is up. Our hospitalizations here in Falmouth, you look way down below on 1-3. We had 16 in the hospital with 2 ICU beds, where Cape Cod Hospital had 28 in the hospital with 7 in the ICU. Those numbers are very close to what you see up at the top, which gave us the numbers from this past April, which was very similar. We had 19 and 7 and 27 and 6 with 46 total and 13 in the ICU. So that's similar numbers now than what we had early in the pandemic when we had all the surge and the concerns about that. So the hospitals are high, getting high counts, reflective of the amount of cases that we've had, especially in Falmouth over the couple of previous weeks when you have long-term care. It takes a while for someone in long-term care to make it back to the long-term care, so they tend to stay in the hospital for longer periods of time, and they end up with that happening in a little bit of a back. So there are obviously more cases, more hospitalizations, and more ICUs, people in the ICU. The 2 long-term care, the Royal and the Atria, are both doing better. There are a couple cases here and there popping up, but all in all, the 2 big case bumps that we had a couple of weeks ago have definitely leveled off. So that's it for cases. I think everybody knows that the cases are high. You know, we're holding our own, but they're still higher than we've seen them. As far as COVID testing, a drive-through test site is already at the hospital. That hasn't changed. You still call the 508-862-5595. This changed the Barnstable County number. I just saw that. But you can also call Barnstable County, go on their website, barnstablecounty.org, and schedule through the fairgrounds. That's still available, it's still operational. Of course, the walk-in clinics, Convenient MD has been done a ton of testing in this town. The East Falmouth CVS, Community Health Center of Cape Cod, all that still continues on. So nothing's different with revisions and gatherings. That hasn't changed. It's pretty much 25%. Outdoor gatherings are, as far as restaurants, close personal contact at 25%. If you own a business and you need any questions, give us a call. What I like to spend most of the time with, and I'll talk about in a second, is the vaccine, because that's the big question that we're getting. So, again, time to start implementing the things you did to keep yourself safe in the spring now. Now, the cases is higher, probably pushing that or greater than the spring. It's hard to tell in the spring. We didn't have a lot of tests, but you need to start implementing things that you did to keep yourself safe in the spring and start doing it now. So that means mask wearing, indoor and outdoor, okay? Hand washing, hand sanitizing, reducing or eliminating travel. The gatherings, even with friends, you know, how most people happen is they were surprised that they got it from either a relative or someone in the household, or, you know, someplace where they've seen that same person over and over. Well, eventually it creeps its way in towards you. So you need to make sure that you're for the next couple of months, really buckling down. And again, following state guidance. Again, if you got complaints from a particular place, whether it's your business or that you work at, or you visited shopping or something of that nature, you can call the health department. We do follow up on all the complaints. We do send someone out there to see what they're doing with the guidance. So that's what, you know, that is pretty much the same speech I've been giving you guys for the last few weeks. And so let's move on to the vaccine. So where are we? We're in phase 1. So that is clinical and non-clinical healthcare workers doing direct COVID-facing care. Cape Cod Healthcare has gone through and is already starting up, I think, this week with their second dose. So that's already in progress. Okay. Long-term care facilities are starting up. I've gotten some emails from the long-term care this week that some of them are starting that up. Police, fire, and emergency medical services, was given the responsibility for the health department to work on. We've taken care of that. The Sandwich Fire Department has graciously already set it up for the 4 Upper Cape towns, so let's join them. And so they're doing that beginning on the 11th. So next week, the police, fire, and emergency responders have got an opportunity to get the vaccine. Congregate care settings, including corrections and shelters, that's starting. There's a few places I know that have, and so it's sort of in progress. And as with the health care workers doing non-COVID facing care and home-based health care workers, that's sort of in progress. If that's one of that belongs, and you guys have questions, if you're listening to this and that affects you, then give the health department a call, and we'll refer you. Okay. Phase 2 gets to where a lot of people, elderly, comorbidities, certain types of public works, public health workers, sanitation stuff. That's phase 2. Now, and phase 3 is the general public. And let me give you a little detail. We don't have all the information. So the state essentially hasn't given us the entire game plan of exactly how they want everything to be done. So I get a lot of questions. Can I put my name on a list? Where are you going to do it, how you're going to do it, how many people you're going to do. The state has not told us how many people we would be doing at the local health department, whether it's going to be spread out amongst a lot. All we've been told so far from the state is we will not be a depot, which means any of these entities that want to get it, doctors' offices and so forth that want to sign up as a clinic, they wouldn't come to the health department to get it. They'll get directly from the state. So we're not going to be a depot. They asked us to take care of the first responders, and so we've done that. But they haven't released details that allows the town to put concrete plans in for vaccinations as of yet. So we're in preparation to do clinics. We have an EDS, an emergency dispensing site. We have 2 sites. It's the high school and the Gus Canty, but the high school, this is a much longer duration than what the EDS plan that the state had us do a decade ago or so. So the high school may not be the place for it. It could be where we're doing the vaccination. Doing the testing at the fairgrounds and things of that nature. So we're in preparation to conduct the clinics, the where's, the details. We've got a plan. So it's just, we just don't know whether, our plan, is it going to be, are we going to be doing 500 a week, 5,000 a week? Or are we going to get dribs and drabs of vaccine in? How is it going to work? The state hasn't quite told us yet. So it'd be nice if you don't call the health department. We're getting about 20, 30 calls a day looking to schedule and want to know. The information is going to be provided when the time comes. So we don't have even the scheduling software called PrepMod that everybody's going to use to schedule vaccines. If you use PrepMod, you schedule it. That way the state can track who's been vaccinated. We don't have access to that program yet. It's not completed, or I think they had some glitches where they're working it out. So we're not at a point where I can say you're going to be ready to rock and roll. We're going to have a clinic standing up April 3rd or March 15th or May 10th at this place. Call us. When we've got to that point, we'll definitely give out that information. But the scope hasn't been defined yet. So is it going to go to a lot of different places where you're going to have a lot of other opportunities to get it? That's to be determined. So, I mean, I don't know from the state yet. The health agents, we've all talked all the time. We just don't have all the information that tells us exactly, what our defined role will be. Obviously we'll be having clinics, and we can handle that. We do flu clinics and just scale them up and have them longer duration. We can do that. But there's other things like having to come back for the second shot. It's not something we had to do with the flu. So there's, we've got a framework. We've got a plan. It's just tailoring it to the specific role that we're going to be defined in having. Is it going to be long durations and less people? Are we doing 300 a day for 2 months, or are we doing 5,000 this week and none for the following week? I don't know how the vaccine is going to come out to us, so we don't know that yet. So sorry if it frustrates you, but if no one's more frustrated than I am, not knowing exactly what we're going to be getting into. But we're still working on, we'll get it hammered down. It's just, we just need to know more from the state. All they've asked us again is to take care of the first responders, and we've done that. So that's where we're at. Now, if you're a medical personnel that you want to volunteer, and we're getting a lot of calls, and I'm so glad we have, you would call Diana Gamond at the MRC director, which is the Medical Reserve Corps, at 508-375-6641, or email her. The email is on here. That is the Medical Reserve Corps is out of Barnstable County, and then that's where they're going to vet all the medical personnel, nurses, doctors that may want to shoot the vaccine, give the vaccine out. And then that would go through there, and then we would pull from the MRC when we need them. We also will have the VNA doing it. The VNA will be our depot for storage of the vaccines, and so and so won't the county, Barnstable County as well. So the MRC director, Diana, would be somebody you would call to be on the list for volunteers. And so if you want to do that, that's what you would call. We do get quite a few people calling. We refer everybody over to there. So I wish I had more details, exactly the who, what, when, where, and why. It's just that we don't have all the details submitted to us told to us from the, sorry to be repetitive, but we are getting tons of calls over it. So there's a lot of different departments involved with it. There's the administrative component, PrepMod, scheduling, who's coming today, who's not coming today. It's not going to be a free-for-all. Everybody just shows up on day 1. And we don't know who's coming back on day 28, and then we just let you come and decide that. So it's going to have to be some sort of controlled. Probably be done out of the Emergency Operations Center at the fire station, and staffed. We'll need IT, the communications department, fire, a lot of that. There's also going to be the end of getting the clinic done. So we're going to use the CERT volunteers, the VNA nurses, the MRC nurses. Police detail. Since it's the first time you're ever going to get this shot, we'll need a fire detail. So there's a lot to go through, and we'll be doing that. Once we have our spot, we have it all set up. We'll be working it that way. So there's a lot of different departments that'll be involved. A lot of intricacies in doing this, because it's going to be a long duration. It's not going to be like we'll be able to give everybody a shot right away. My guess is they'll be coming in chunks, and then we'll be dealing with that as we go. And so, we definitely know we definitely are well aware that we'll be playing a role. It's just to what level. Will we be doing 5%, 15, 50, 75% of the population? We have not been told. To recap, state metrics remain high. Way more than 50% of the towns are in the red. We stayed yellow, but we're still at the highest rate we've been before. Definitely got community spreading, especially among small gatherings, small meetings, small groups of people that know each other is generally how it seems to be spreading much more than it is sort of random. But there definitely is random occurring as well, and generally it's probably from going into small confined different spaces. The vaccine is being administered at Cape Cod Healthcare, starting at the long-term care congregate living over the next few weeks. First responders will be next week. And further vaccine information will be released as it becomes more clear. We just don't have the clarity to start announcing things at this point. So I'll do this presentation. If I have more information on the vaccine details and stuff like that, I'll give them to you. And so we'll do this again this Friday and see everybody then. Thanks.